So welcome to this morning's presentation on the importance of keeping yourself hydrated and anybody that you look after and anyone that you care for. And I'm Julie Hayes, and I'm the NHS Cheshire Merseyside Hydration Improvement Lead for this locality. So what we're going to do, I'll look at some things in relation to basic hydration, the importance of keeping hydrated and recognising signs and symptoms of being dehydrated. And then also we're then going to look at some of the heat stuff, because we're coming into the summer. So it's about being sensible and looking after yourself and anyone that you care for. Okay. So good hydration can help prevent in reducing an awful lot of conditions. It's not just about having a drink of water and it just is like a dietetic type issue, but it covers lots of medical specialities, okay? So it will do things like reduce urinary tract infections, things like headaches, constipation, dizziness, which then can lead to falls, okay? Things like confusion, things like poor oral health, and also impact of your skin as well on skin ulcers and skin conditions. Okay. So why does our body need water? Well, we need it to exist, okay? It regulates and controls our body temperature. We can go a number of days without food, but we can't go without fluids, okay? And as I say, it has lots of other functions where it helps lubricate our joints, okay? And it's basically the way nutrients, oxygen, and all of those are dissolved into the blood, and it's the way it then transported around the whole of the body. So it's really important that we have keep our fluid uptake. So who's going to be at risk of dehydration? Okay, anyone who's dependent to get them food or drink. So that could be somebody that you look after. Okay, if they have swallowing problems, some of you may know it as dysphagia. Okay, if you've got a high temperature because you're unwell, and sometimes the temperature will occur first before you have any of the signs and symptoms of other types of diseases, okay? Especially if you've got sickness and diarrhea, because obviously you're losing water in both directions, okay? And you need to be able to replace that, okay? If you're taking part in any physical activities, all right? If you're limiting your drinks because you don't want to go out to the loo, throughout the day, or you're trying to reduce the amount of drinks that you have after a certain time at night so you don't get up in the night as well. But it's really important that you don't yourself reduce those kind of things. You need to keep hydrated throughout the day. Okay, and it's really important if you look after somebody that you don't start doing those things as well. Reduce their fluid intake so it stops them getting up and going to the toilet, or it stops them getting up and going to the toilet at night. Okay, it's really important that you keep hydrated throughout the day. But basically anyone can become dehydrated, and very rapidly and very quickly. Okay, so what are the impacts of dehydration? If you become that dehydrated, so it's either yourself or somebody you look after, you can end up with an unplanned admission to hospital. And anybody knows how traumatic that is, to be a carer of somebody that ends up having to go into hospital on, an unplanned A&E admission. It's really traumatic. It's really stressful. It's really stressful for them, and it's really stressful for you if you have to look after them. Okay. It causes an increase in urinary tract infections. We call them UTIs for short. Okay. Antibiotic resistance, which is basically where antibiotics are starting to no longer work. Okay. They can lead to serious implications in relation to things like sepsis and death if you become too dehydrated. Increased falls, because then that can lead to things like dizziness, low blood pressure, unsteadiness on your feet if you become dehydrated. And the impact of a fall on anyone is pretty traumatic. Okay. Cognitive impaired changes. So if you're looking after somebody who's got dementia or any of those related illnesses, what happens is that basically you'll begin to notice a change in them. They're not their usual selves. They may become agitated, more confused, more distressed. Okay. A dry mouth. Okay. So that's another good symptom. So if we start to get to the point of having a dry mouth, then that can usually be a good indicator that we are becoming dehydrated. Okay. And some medication doesn't work as well if you are dehydrated. So if you're taking things like laxatives and stuff like that, it's really important to keep yourself hydrated because the medication actually works better. Okay, so spotting the signs and symptoms of dehydration. Okay, are they drinking less than usual? Okay, not everybody feels thirsty, and if you suffer with things like, as I say, dementia-related illnesses, then what happens is that sort of stimulus within your brain isn't there. So it's the thing of like you're asking, would you like a cup of tea? It's the same way they do it in care homes where they have protected meal times and protected, drink times and stuff, because they're having to go around and say something, would you like, and prompt them to have a drink. Okay. Is the urine that you're producing or they're producing, has it gone darker in colour? Is there a smaller amount? Is there a smell to it as well? So sometimes that can be a good indicator that you're becoming dehydrated. Are they, or you suffering from headaches because you're dehydrated? Okay. More tired than usual, more sleepy. Okay. Do they have a dry mouth, lips, or eyes? Okay. Is there a lack of concentration? Okay. Are they appearing confused? Is there an increase in constipation? And it's one of the signs and symptoms that we can have if we don't have enough as well. One of the first signs you'll start to see is the change in your urine, but also you can become mildly constipated. Okay. And as I say, the most important one is then urinary tract infections, because your kidneys and your bladder aren't being flushed through. Okay. So why does it affect older people? One, it's that aging process. Unfortunately, we're all aging, and it's not a good thing because things start not working in the same way that they used to. And so basically there's a few different things that go on. Okay, so it starts with your kidney function that starts changing as well. Okay, and it's that thing, particularly if somebody's got dementia or Alzheimer's, it's that thing of that stimulation or that response to, am I feeling thirsty or not? Okay. And then obviously with things like frailty, when someone's lost a rapid amount of weight, where we actually store most of our water is in the muscles. Okay, so if you lose that kind of body build and you end up with things like frailty, then you're going to lose the amount of areas and the amount of capacity you're able to store body fluid in your body as well. And as I say, it may be physical things like the actual physical process of holding a cup. So if you've got arthritis, if you've got any conditions that affect your hands as well, are they able to hold a cup? If somebody's got Parkinson's, the typical tremor, it's very difficult for them to hold a cup safely. Okay. Communication difficulties, because someone may not be able to convey to you, I'd like a drink. So if somebody's had a stroke, or if somebody's non-verbal, or if somebody's got dementia, they may not be able to communicate effectively to say, I'm thirsty, I'd like a drink, and I'd like a drink of juice, I'd like a drink of tea. Okay. If anyone, as I say, got cognitive impairment due to Alzheimer's, then what can happen there is, as I say, that stimulation in the brain starts to go. And if you become dehydrated, you begin to change. And as I say, where you get things like confusion, agitation, all of those things. And if you look after somebody, you begin to know exactly what is normal for them and when you can pick up a change quite quickly. And if anybody's got any swallowing difficulties, and as I say, the correct terminology is dysphagia. So if somebody has something like Parkinson's, where it affects the swallowing, if somebody's had a stroke, anything like that that will impact on swallowing, then that can also make quite a distressing issue for them. Because if somebody's got a point where they haven't had their dysphagia or the swallowing issue diagnosed, they can actually find that the actual act of drinking and eating becomes really stressful because they think they're going to choke to death. So that's why it's really important to make sure that someone's been properly assessed for swallowing issues. Okay. So regular fluids, we all need regular fluids, okay, throughout the day. And as I say, it's most important you keep yourself as a carer well hydrated, because as carers, we always put ourselves last. So the most important thing is that we are hydrated and we are sensible enough to make sure that we're looked after first and foremost, because we always put ourselves last, as I say. But anyone that you're looking after, make sure that they are cared for, that they get a regular amount of fluids as well, and throughout the day and the evening. Okay, and this can be different amounts. All right, some people may be on a restricted diet, so they may not have to drink as much as others. So it's really important to know if somebody's on a restricted fluid diet that you don't change that. That has to stay. The reason why is because of a medical condition or dietary needs as well. So it's most important that you recognise that and don't try and give them extra fluids, because it can have serious implications. But for most of ourselves, we look at, on average, it tends to be about 3 pints for females and about 3.5 for males. Okay, and it's drank throughout the day, and and we use like a variety of choices. Not everybody likes tea and coffee. Lots of people like water. Lots of people like boiled water. Lots of people like ice cold water. Some people like juice. It all just depends. But it's that thing of not just offering one type of drink throughout the day, offering an awful lot of choices. Okay. And as I say, it's about the variety. And as I say, it's not one of those things, because I'm a non-tea coffee drinker, the first thing everybody always offers to me is tea and coffee. Okay, so as I say, it's really important that you have a choice and ask the person, what would you like to drink as well, and not working on the assumption that everybody likes tea or everyone wants a hot drink. Okay. And as I say, a lot of people don't like having an awful lot to drink because they're worried about having accidents, incontinence problems. And it's really important to just remind them that, yeah, it's okay, but it's one of those things of like, when they first get the stimulus to go to the toilet, they actually act on it and go there and then, and not delay going, because that's when usually accidents tend to happen. Okay. And as I say, somebody has favorite cups, somebody has favorite mugs, somebody has favorite glasses. We all like those favorites. So it's one of those things. Is that mug too big for that person to hold? Do they feel overfaced by the amount of fluid that's in it? So do they want a smaller cup? But also the same kind of thing is, can they actually hold the cup that you're giving to them? And particularly with anybody who's got dexterity or, holding issues. Okay. So why is it a big focus on hydration? Because it's a big national project run by NHS England and UK HSA, and a pack came out in October last year, and what it looks at is the importance of reducing urinary tract infections by keeping everybody safe, well and hydrated. And it's aimed at the over 65s, and it's also aimed at people who are paid and unpaid carers. So that might be professionals, and it may well also be the likes of you and I, where we've looked after family members. So it's about looking after yourself first and foremost, but looking after those and being able to recognise signs and symptoms. Okay. So what is a UTI, or a urinary tract infection? It can affect the urinary tract, so it includes the bladder, the urethra, the kidneys, okay? And it can become an issue because where it gets more severe is due to dehydration. And if you're an older person, the consequences of it becoming very serious happen very quickly, and you're more at risk, particularly anybody over the age of 65. So it's whether you look after them or whether you're over 65 as well. So there's massive implications with the urinary tract infections. And the sad thing is, they're more likely to end up in hospitals, and sometimes they can end up with serious implications from a urinary tract infection like sepsis. And that's one thing we want to try and avoid. We want to try and avoid unplanned admissions to hospitals, and we want to try and avoid the serious consequences like sepsis. So what are the signs and symptoms of a urinary tract infection? Okay, so sometimes you'll get problems like I need to go to the toilet more frequently, and you'll notice that. And particularly, somebody incredibly well that you look after, it's like, hang on, they're going to the toilet a lot more frequently. Are they complaining of pain when they go to the toilet? Are you noticing things like, is the blood actually within it? Is the reduced amount of urine, is it changing colour? Is it darker? Is it smelly? Has it got like an offensive smell to it? Okay. Are they complaining about any lower tummy pain or any back pain, anything like that? Have they got a temperature? Has the temperature gone down to below 36, or has it gone above 38? And are they getting things like shivering, okay, and a high temperature? So there's lots of different things. There's also obviously things like changes in behaviour, because if you've ever looked after somebody with dementia, you can pick up straight away when something's not right. It's just like a sixth sense, and you just know that something's not right, but then it's trying to find out what actually is the cause of it. So have they got any of those other signs and symptoms we've just talked about? Okay. And as I say, do they have a high temperature? And anyone who's got a urinary catheter, they're more specialists, so they'll need further specialist advice. So that's why I've not gone into too much detail about looking after anybody with a catheter, because they are a different ball game altogether. This is anybody who's not catheterized. Okay. And what we're trying to do is making sure that anybody is properly diagnosed with having a urinary tract infection, and not just thinking, oh, hang on a minute, just a bit confused, but you've got no one of those other signs and symptoms. And sometimes that can mean that you've rang up the doctors and said, oh yeah, they're a bit confused today. I think they've got a urinary tract infection, but if they don't have any other signs and symptoms, is it actually something else? Because it may well be another type of infection and not a urinary tract infection. So usually we get given antibiotics. They're usually brilliant. They usually work perfectly well. But as I say, it's really important that you are looked at, medically checked over. And it's also that you are given antibiotics appropriately, you take them appropriately, and you finish the whole course. All right. We do get awful lots of side effects with antibiotics. So as well as being absolutely brilliant in curing the condition, sometimes they can give you a few more little other issues as well as a side effect. There we go. And as I say, it's what we're looking at now, though, is that some people have taken antibiotics, and we're all probably guilty of this in the past, where we've used antibiotics inappropriately, where we've actually had a sore throat, which has been a viral infection, not a bacterial infection. And antibiotics only work very well on a bacterial infection. And so what's happening is that if you're taking antibiotics when there's no need, you can actually be causing problems in the fact that antibiotics are now starting not to work. We've not had antibiotics developed for an awful long time, and there doesn't look like there's going to be any new ones developed. So the higher end range of antibiotics that we use for people who are very ill in critical care, in intensive care, are now not beginning to work the way that they should do. So it's really important that if anybody has antibiotics, that we use them. We get given the course by a GP or a practice nurse or anyone else who is able to prescribe antibiotics, and that we take the whole course. We don't leave a few at the end and think, well, I feel much better. I'm on a 7-day course and I need to take 3 because I feel a lot better. No, it's really important that you finish the course. What you shouldn't do is share your antibiotics with anyone else. So if someone in the family starts to become unwell and you're already on antibiotics, it's like, oh, have some of my antibiotics, they may stop it. No, that's really naughty to do. So no sharing of antibiotics. Your antibiotics are for you, and they shouldn't be shared with anyone else. Okay. So it's really important that when you have antibiotics, you complete the whole course and you finish them. And what you shouldn't do is then go looking on the internet to try and buy them as well. It's really important that you're clinically assessed to make sure that is the infection that you've got, is that a urinary tract infection, or is it another type of infection as well? So as I say, antibiotics are really good, and particularly if you're being prescribed one for a chest infection, respiratory infection, anything like that, or a UTI, that you seek proper medical advice first. Okay. So then what we have to also then look at is back to basics. And I know it's a really daft one, but it's the importance of, if you're looking after somebody, particularly if you're changing pads for them or taking them to the toilet, make sure that you wash your hands after handling any pads, after handling any soiled underwear. After you've just taken somebody to the toilet, make sure that you wash your hands. Make sure that they still wash their hands as well, because it's very neglected in the fact that sometimes you'll wash your hands and then they'll just go off and not bother washing. So it's really, really important that everybody has and practices good hand hygiene after toileting or looking after somebody if they need toileting or a pad change. Okay. Things like pads, okay. If somebody's got a soil pad, it needs to be changed immediately. Someone shouldn't be sat in a soil pad for any length of time, because it can cause problems in relation to skin integrity on your bottom and stuff like that. Okay. And then it's that old adage of like wiping your bottom in the right direction. Okay. Not from back to front, but from front to back. Okay. And then avoid using these nice smelly products, because perfume's an irritant, and around you sort of like your bottom and stuff, things like perfumes are not good. They really can cause an awful lot of irritation. And, you know, so it's really important that you don't use those kind of products. Okay. And if anybody's got dipstick tests at home, we really recommend that you don't use them for testing urinary tract infections. You must seek medical advice first. So that must be your GP, pharmacist, or a practice nurse instead. Okay. So what should you do if you think somebody's got a urinary tract infection? Okay, there's lots of different people that we can contact. Okay, your local GP, a senior practice nurse, community pharmacist, because we've got lots of schemes now where you can go and seek medical advice from your community pharmacist as well, the walk-in centre, and then we've also got the 11 NHS service, telephone service that you can do. So if you think that you've got it, or you've got somebody who you look after, there are lots of different options, because I know it's very difficult sometimes to get a GP appointment or to get through to the GP practice, but there's lots of other options that you can go to. Okay. There's also NHS A to Z conditions, which you can have a good go, because lots of people will go over the internet and start looking at different ways of diagnosing. And there's an awful lot of misinformation, confusing information. If you're going to go Googling for proper medical advice, the best one is NHS A to Z conditions. Really good source of information, loads of different things, okay? And it tells you what to do if you've got it or if you're looking after somebody, okay? And that's actually what it looks like when you Google it, okay? So as I say, it's got loads of medical conditions, A to Z. So anything that's usually what we tend to go for GPs or medical advice for, it's on there. So you can always go and use that first, okay? If you do get to see your GP, they may do a lab and ask for a lab specimen, okay? So it's really important that you follow the instructions on how to take it and that you label the bottle correctly, okay? They may tell you exactly what to do in relation to looking after yourself. So it may be painkillers. They may give you antibiotics, okay? But they may also give you an antibiotic prescription, but told you to suspend it for like 48 hours to kind of see. But again, that will be under the GP advice, and they'll be able to tell you exactly what to do. Okay. And as I say, even if you do get given antibiotics, the most important thing is that you finish the whole course. Don't share it with others, and complete the whole course, even if you do feel better after a few days. Okay. So just back to what's it called, some of the signs and symptoms. So it's really important that when you're going to tell somebody like a GP or a practice nurse that you look at these kind of things. Are you having to go to the toilet, or are they having to go to the toilet far more quickly? Are they having any pain, new pain, or a burning sensation when they're actually having a wee? Okay. Are they having to increase, going to the toilet at night? If they're incontinent, has that got worse? Or is there any signs of new continence type issues? Okay. And as I say, are they complaining of any lower tummy pain or any lower back pain as well? Okay. And as I say, things like recognising other spots of blood within your urine, okay? And are there any changes in their behaviour, become agitated, confused, okay? And do they have a low or a high temperature, okay? And as I say, it's simple things of how to avoid. So it's that thing of trying to keep somebody hydrated as well as yourself, okay? And there are lots of different choices that you can have to, you don't have to just have cups of tea, okay? And as I say, it's the amount that we have during the day. But if you are on a restricted fluid diet, it's really important that you do not change this. You must seek medical advice first. You're on a restricted fluid diet for a reason, okay? And it's, keeping up with your personal hygiene after you've been to the loo or after you've looked after somebody. As I say, wiping your bottom in the correct way from front to back, not back to front, okay? And then making sure that you're not using too many perfume products or things like bubble baths or bath bombs and stuff, which can be quite an irritant, okay? So there's quite a few different things. There's also some videos as well that you can watch, and there's some really good ones. They are NHS based, so they're really good, very simple to understand, and really, really nice short videos for anyone of any background can have. There's a hydration video and there's a catheter video as well. And we're coming into Beat the Heat. We're starting, 2nd of May today. So what we're doing is we're coming into warmer seasons, which is nice for an awful lot of us. However, not everybody feels the same about the heat, okay? There's a big government campaign and it's called Beat the Heat, and it's used for anybody. It's a common sense approach, okay? And it can be used by anyone throughout the whole community, and it's just very sensible things, okay? And as I say, anyone can become unwell in hot weather, so it doesn't matter whether we've got an underlying disease, illness or whatever. Too much heat for some people is not a good thing, okay? So it's just very simple guidance. So it's the impacts of hot weather, okay? It can sort of like exacerbate things like heart attacks, strokes, lung problems, any other disease, particularly if you've got things like COPD, asthma. Hot weather is not good for us asthmatics, okay? Older people, younger people, babies, anyone can become unwell due to hot weather, okay? But anyone with an underlying medical condition, this can have a serious impact on hot weather on their medical condition, okay? And so lots of us love the sunshine. You can't be pleased, without, a day of sunshine. It does make the world seem brighter, okay? But it can cause lots of other people to become quite unwell. And as I say, we don't want things like increased dehydration, heat exhaustion, or sunstroke. They're some of the things we really don't want, okay? So just some basic top tips. Keep out of the weather, the hot weather between 11 and 3, okay? If you're going to go and do a physical exercise, like taking the dog for a walk, take the dog for a walk when it goes cooler, either first thing in the morning or sort of later on in the evening. And not only that, dogs don't like hot, their poor little feet on hot pavements too, okay? They get really hot just as well as us. So if you're going to go for a jog, then do it, first thing in the morning or last thing at night. Don't go jogging midday, okay? You can do things like closing windows and stuff like that, and also closing curtains, particularly in a very bright room where lots of sunshine actually comes in, okay? Do make sure that you wear appropriate clothing, all right? Not too many layers, and things like putting your sunscreen on, wearing a hat, something like that will just protect you from the heat, okay? And do drink an awful lot of fluids. However, the most important thing is not to increase your alcohol intake, because alcohol can have a very dehydrating impact. So it's lots of the other good fluids like teas, coffees, smoothies, milkshakes, anything else that is really good for you, okay? But if you are on a modified diet, do check first what you're going to be eating and drinking, okay? And do check on other family members, because not everybody that you look after lives in the same household as you. So you may be out at work, so it's asking a neighbour if they can just check and just find out that your mum's okay or your dad's okay and hasn't been out in the sunshine, okay? And then, as I say, the most important thing is knowing and understanding what are the signs of heat stroke and dehydration and heat exhaustion, okay? So who can become unwell in hot weather? Anyone. Doesn't matter what age you are, everybody in the community is at risk. However, if you've got any of these things, so if you're older, over the age of 65, babies, anybody with underlying health conditions, heart problems, breathing problems, dementia, diabetes, kidney disease, Parkinson's, mobility problems, the list is endless, basically. Anyone who's on certain medications, all right? Anyone with serious mental health issues as well, okay? People become very, very ill, particularly if you've got stomach bugs like sickness and diarrhea, okay? So it's really important to keep yourself hydrated. Anyone who's got alcohol and drug dependence issues as well, okay? And anyone who's physically active, getting out all the time, and as I say, things like runners, cyclists. And it's really important as carers that we look after ourselves. So these are some of the activities that we do to try and neutralise the impacts of being a carer, to be able to get a bit of downtime for ourselves. Anyone who does a very physical intensive job or is out in the sunshine an awful lot, okay? And anyone who's suffering from homelessness as well, it's really important that, you know, we look after them. And as I say, anyone who lives alone is unable to ask your neighbour, because I think sometimes that neighbourly community spirit sometimes tends to go. So it's really important to check on your elderly neighbours just to find out that they're okay. So to prevent dehydration, as I say, drink fluids regularly throughout the day. Don't be restricting fluids, particularly throughout the day and even at the evening, okay? And there's lots of good choices. It's not restricted to one thing. So it's not just tea and coffee. We can have other things like squashes, pure juices, milks, anything like that. Anything that, you know, is a good way of getting fluids down us, okay? And as I say, if you are on a restricted or a modified diet, please check first before making any changes to your diet. And as I say, whenever you go out, take a bottle of water with you. You don't have to buy water when you're out. Get yourself a water beaker. Make sure you've kept it in the fridge. Keep it really cool, because you don't know when you're going to be stuck on the roads anywhere. You don't know how long it's going to be before you're able to access a toilet. So it's all of those sensible things of making sure that you've got these things with you, and that, you know, you always carry yourself like a bottle of water, or you've got like a water bottle that you can take with you and for the person that you're looking after. And as I say, alcohol, well, we all do like the odd glass of alcohol. However, it can have a very dehydrating effect on us. So, you know, if you're going to go and sit in the pub, you know, in a summer garden, do make sure it's not in the heat of the day, and that you have like a fruit juice instead rather than having alcohol, because if you do have alcohol, it's really dehydrating. And as I say, if anyone's fasting due to whatever reasons, it's important to drink adequately and sensibly, okay? So as I say, and particularly if you've also got an underlying medical condition. Okay, so here we go. So things you can do, all right? So as I say, close your curtains if you've got a room that has lots of direct sunlight. If you live in a room where you're in a house where you've got other rooms to move to one that's cooler, okay? Open windows when it's safe to do so, okay, and have the air flowing. If anybody uses a fan, don't aim it directly, but have it circulating so it moves the air around the room, okay? Check your heating's turned off, because sometimes we forget that it's programmed and sometimes it'll just carry on. And if ever you go like to care homes and hospitals, you know how hot it is and how intense it is. It's absolutely boiling in the summer, okay? And it's things like, you know, just making sure that you don't use as much electrical equipment around the homes, all right? And I say the most thing is, you know, can you, if you've got a spare bedroom, is that in a cooler part of the house? Can you sleep there instead? Okay. And as I say, there's lots of different places that you can go to that are nice and cool. Your library, your church, lots of different places, okay? So it might be a bit hot in your own home, but where else can you go and sort of escape from the heat? So where to get advice, you can go Googling, and it's called Beat the Heat, Okay, and then there's also your NHS A to Z conditions on heat exhaustion and heat stroke. And then there's also things like sunscreen and sun safety. But as I say, the consequences becoming dehydrated are really serious for all of us, not just the people we look after. We're equally as much as risk, okay? So it can have more more issues in relation to confusion and delirium, increased falls because of low blood pressure, dizziness, constipation, that can affect all of us, okay? And if you're constipated, things like your laxatives don't work as well if you're not hydrated, okay? The increase of urinary tract and respiratory tract infections. So even if you've got any of those, it's really important if you're unwell to remain really hydrated. We're very good at doing this with children, but sometimes as adults, we don't do it as well, looking after ourselves when we're actually poorly. The consequence in relation to older people, particularly those with dementia, they may not feel the need of thirst. So it's really important that you prompt them and encourage them to drink. And as I say, maybe better smaller amounts throughout the day rather than a big, large mug of tea. Okay. May causes things like tiredness and fatigue, lack of concentration, confusion and headaches, dry mouth or lips, or unplanned admissions to hospital as a serious consequence of dehydration. So it's not just one thing that dehydration impacts, there's lots of medical conditions and how it impacts on our body as a whole as well. So there you go. So any questions? There we go. Nope, that's fine.